Hi, everybody. If you have a child who is in chronic pain or chronic symptoms, or you yourself are, then this is going to be a good episode for you. I am Jen Johnson. You are listening to Thought by Thought Healing, and on this channel, I talk about everything related to chronic pain and chronic symptoms and why you can recover from those things. I personally come at this from a Christian perspective, and so if that's important to you and you want to approach your healing in that way, then you should check out my website, which is thoughtbythoughealing.com. On this channel, I interview experts, and today's experts are going to talk about working with kids with chronic pain because it is slightly different than doing your own work of healing as an adult. So I'm going to read a little bit about my guests, and then we'll dive into what to do and how to interact with your child who has chronic pain and how to help them to reverse their pain and recover. Doctors Kinderman and Yanek are the co-creators of the dual therapist model, a revolutionary new approach to psychotherapy aimed at enhancing the client experience and preventing clinical burnout. Dr. Michelle Kinderman is a licensed clinical psychologist who earned her Doctor of Philosophy degree from the California School of Professional Psychology in 2000. Dr. Kelly Yanek is a certified school psychologist who earned her Doctor of Psychology degree from the Philadelphia College of Osteopathic Medicine in 2006. After experiencing burnout in their prior jobs, the two friends joined forces to challenge industry norms and develop an approach to living life that highlights human connection and prevents professional burnout. Both doctors are trained in pain reprocessing therapy, and utilize their dual therapist model to treat children and adults at their practice called Wellness Outside the Box, located in a beautiful 20-acre farm in Princeton, New Jersey. So without further ado, I give you these experts in the field of working with children. I hope you enjoy. Bye. All right. Good morning, everybody. Let's get started. I am super honored to have Dr. Michelle Kinderman and Dr. Kelly Yanek with me this morning. Did I say your last name correct, Kelly?
Yes, you did. It's Yanek like panic.
Yanek like panic. That's so good, especially with the work we do.
Yeah.
Perfect. Well, good morning. Thank you for being here. Where are you calling in from?
We are in Princeton, New Jersey.
Princeton, New Jersey. Okay. And I'm in Seattle, Washington. So Kelly and I were talking about before, we're on the opposite sides of the country. So 3 hours difference, I think. Is that right?
Yep.
12:30 there. Okay. Or 11:30 there, right?
7:30.
Cool. Well, I normally only have one person on the show. So I'm sure you guys are totally versed in this because you run a dual therapist model. So I'm sure you're used to talking over one another, but bear with me as I try to not talk over everybody and ask questions so that you know who answers. So let's just start a little bit. How did you guys get into working with people in chronic pain?
Go ahead, you start. Okay. So we are both sufferers of chronic pain, and so our story is a little bit interesting. Like other people you've had on your podcast, our story can be sounding a little bit similar. That I had my chronic pain happened after I was taking a nap in a beach chair on vacation. And I wound up with extreme back pain from that. And a few people suggested John Sarno's book. And I said, oh, a book isn't going to solve my pain.
Yeah.
So then I did the, doctors and muscle relaxers and all of the things, and came back to, well, I guess I should try and read this book. And about halfway through the book, my pain went away. So
oh, really? You did have
I did have a Sarno experience where I
wow.
became a fever. And through that process, Michelle was one of the people that was telling me about reading the book and her experience with chronic pain. So,
Well, let me just interject something
Yeah.
to that story, that it was the last day of your vacation.
yes.
So,
Oh,
and she took a nap in the chair at the beach on the last day of her vacation, which she loves the beach, and she was going to be coming back to work. And
Wait, and not this work. This was
yes.
a previous job.
right.
Mhm.
So, when I saw her after that, she was walking around like 100-year-old lady, couldn't bend, was in really a lot of pain. And she told me how she injured herself. And I kind of said,
Yeah.
that doesn't make sense. How
Yeah.
do you injure yourself from taking a nap at the beach?
Yeah.
So,
Right. So then,
yeah.
Michelle was telling me about Dr. Sarno and his work. And so I became a believer, and then was a complete believer and we wanted everybody to know about this. So we crossed paths with some other professionals in the field and really felt like we would benefit from sharing that with other people.
So you were both therapists at that time then?
Yes.
Yes, but in different positions at the time. We hadn't started our work together yet at that point.
You were just friends or acquaintances at that point?
We were friends. So we met, our kids are 16 now, and we met, they were in daycare. So when they were little, we met at the daycare. We realized we were both in the field. And so we developed a friendship first, but we lived in opposite sides of New Jersey, and Kelly was in the school system. I was in a hospital-based system, and we both started feeling burnt out in our jobs. We got tired of fighting rules that didn't really make sense, and we felt like we had our wings tied. And so brainstormed, and we came together and created something new.
And so when you think about that pain and the pain story and how it corresponded with really needing to make a change, and you know, it all fits together looking back.
Right. Absolutely. So, and Michelle, did you have, I heard you say you had burnout. Did you also have chronic symptoms, physical symptoms with that?
So I had chronic back pain for years. When I was in my 20s, I had gotten into a car accident. Actually, when I was 18, I had gotten into a car accident. So anytime, looking back now, I can see that anytime I had stress, and I did sort of injure my back, you know, it was just kind of a whiplash thing from jerking, and it healed. After a week, it felt totally fine. But anytime I would have stress or trauma or difficult situations, the pain would go right into my lower back. And I went for acupuncture and the chiropractor and physical therapy and the orthopedist and the X-ray, the whole gamut. And then I finally went to a doctor in New York for injections. And he said, and I had told him that one doctor actually suggested spinal surgery for me. And he said, what were they going to operate on? What were they possibly going to do? And I said, I don't know. He said, this, this, and this. And he's like, have you ever heard of John Sarno? So he actually suggested the book to me. And I read the book, and that was it.
Thank goodness, right?
After many years of suffering, like I couldn't stand for a long time. If I, you know, it was just debilitating.
Yeah. Well, I'm so glad that you both found this work, as I did too. Everybody in this industry has recovered from chronic pain, and it never gets old to hear a good story of, I don't know, that recovery process. So recently I attended the Psychophysiologic Disorder Conference, which is mind-body medicine practitioners and doctors, and was able to listen to you two talk about the work that you do. And I think during that conference, you focused on your work in and with teens and kids. And that was awesome. I haven't heard anybody talk about working with kids before. So that was really inspiring. I took lots of notes. And so, yeah, I just wanted to have you guys on here to talk about that perspective, because we don't hear it a lot of talking with kids. So let's start first with just what does that look like to work with kids? Do you have programs? Are you doing one-on-one? Just for listeners who have kids in pain, we'll start there. And then we're going to talk about difficulties, challenges to overcome with that, along with maybe some things that make it easier. And then we're going to talk about the parents. And I think it will be mostly parents that are listening. So just some tips for them if their kids are in chronic pain, what they can do. So that's a little layout of where I want to go. Let's start with, what does it look like to work with those kids that are suffering?
So we're a little bit outside the box in that we've created the dual therapist model. So we see all of our clients together. So it would be 2-on-1 for all of our sessions as opposed to 1-on-1. So we create more of a team feel in that manner. We're also both certified in pain reprocessing therapy. So we sort of combine those two techniques in all of our work with our clients. we do see a lot of kids and teens. Kelly has the awesome background in school psychology, so that really helps us.
Yeah.
And I'm thinking of the clients that we see and have seen, they come to us at different points in their pain journey. It might be that, we had one that we had discussed, one of the cases we discussed at the conference, a boy who was coming to us and he had, hypermobility and was experiencing chronic pain as a result of that. Luckily, the parents had some indication that it could be a mind-body issue. So
Okay.
it does take a little bit of a door opening from a clinician or a physician to say, this may be something you want to pursue getting help on. But we've also had other child and adolescent clients who are coming either because of emotional issues or behavioral issues, and we see the correlation between what's happening maybe in the home or what's happening with them at school, and how they've got migraines, or they've got a lot, they're missing school because of stomach issues or things like that. And we can sort of then kind of help open the door, crack the door, that it could be a connection with the mind body. So we either have them coming specifically because they're seeking us out for it, or we are able to then educate based on what our knowledge is of the situation.
So you're helping the parents and the client to see the association between maybe them showing up for anxiety and also they think they also have migraines, but you're saying these come together. They're from the same source.
Yes.
Yeah. It's
And
powerful.
about how it is to work with them, just as I explained, was talking about that, it's important to work with both the child and the parents, because you can't really work with one without the other.
Yeah. I definitely want to get into that. Which brings up the question of what, so comparing you're working with an adult to you're working with a child that it may be in situations that are still stressful. That is true for adults also, but there's more autonomy with adults. So let's talk about what pros and cons of a child learning about the mind-body connection at a young age, opposed to at my age, where there was a huge paradigm shift. Sorry, my phone is dinging on my computer and interrupting me. So yeah, let's launch into that comparison, pros and cons of a child learning about this opposed to an adult.
Yeah, we love working with the kids with chronic pain because they're not so, I almost feel like the neural pathways aren't as solidly formed and ingrained as they are with adults. They're very open to treatment for the most part. They love to have fun, and they're very easy to distract. So a lot of times what happens is, because we work really hard to build rapport, build a sense of safety and trust, especially with the kids, to build a relationship with them and to make it fun. They have to want to come back. They have to feel comfortable here. And so it's very easy to get them engaged in some kind of fun physical activity where they forget that their ankle is supposed to be hurting, where their brain, like, it's very easy to calm their brain, to have them laugh, to have them move around. And then as soon as we can get that going, not to trick them, but to say, how did your ankle feel when we were bouncing on the hippity hops? Or how did your ankle feel when we did that obstacle course? And wow, isn't that fascinating? That you have so much pain when, you're sitting in class, but when you're running the obstacle course and having fun, it goes away. And we make sure to validate the pain. We're not trying to trick them or say, oh, you're making it up. See,
Yeah.
that goes along with the psychoeducation piece.
Right. So, okay. So you're infiltrating the psychoeducation, kind of layering in with fun.
Yeah.
Yes.
So we start with like a basic explanation of the brain pain connection, the fear pain cycle, and all of that.
And kids and adolescents are already primed for learning. So their brains are used to having to take in information and kind of work with, and, they go to school. It's a normal it's normal process for them to be thinking about and trying to learn something. By the same token, we're very cautious not to make it appear or give them too many worksheets or give them homework where it feels like a job or an extension of school. But they're already primed to kind of take in and understand information. And there's almost a little bit of sometimes a more willingness from a kid to hear it from an adult, as opposed to sometimes the adults are already, they have their own schema of like, well, wait, you're saying it's all in my head. Kids are open to hearing and understanding that there might be another explanation for what's going on.
Yeah.
Get them to buy into being their own, body detective. What am I sensing in my body? What am I noticing? Like, where else have you noticed that you're not in pain one place, but in some place else you do experience the pain? And, kind of a curiosity. They tend to be much more malleable in terms of that curiosity and the excitement about it, as opposed to sometimes with adults, you get the defensiveness because they've been through so much more kind of resistance going to different doctors and trying to find an answer for their pain and suffering.
I think also the kids love to feel empowered. Like they really love that. So, for example, the child in the case we presented in the PPD conference who had the leg pain, he had the leg pain when he would go on the boring, quote, boring hikes with his parents.
Right. Right.
Had severe pain.
Yeah.
So after we got to know him for a while and we started working with him, he would go on a hike and have severe pain, and he'd come to our office and we'd play and run and laugh, and we'd say, look how smart your brain is, right? So you're not even thinking about it, but you hate those freaking hikes with your parents.
Yeah.
Your brain is sending you severe pain because you really don't want to go. So we need to find a way for you to express that directly with your parents instead of having it come out, because he was very much a people pleaser, didn't want to let his parents down. So we need to give your brain words so you can express those feelings with words so it doesn't have to come out through pain in your body. And he liked that he could feel empowered, that he could change things, he could make a difference.
Yeah. Going back to something you said a couple paragraphs ago, for the listeners, because I'm going to title this something like My Child Has Pain or something like that. So there's going to be regular watchers that already know about the fear pain cycle. And then there's going to be people that have no idea what that is. And I love the idea of unpacking it in a simple way, like you would for a child. What kind of things are you trying to infiltrate, layer into that psychoeducation, the pain neuroscience education? What are the types of things you're trying to get in there for them to understand and now for the parents to hear?
It depends on the age of the child, but we usually start with, if you touch a stove, your brain sends you the signal, ow, hot, and then it tells you to move your hand because that's your brain trying to protect you. So anytime your brain thinks that you might be in some kind of danger, it sends you pain in order to keep you safe. So that's a great function of your brain. It's a great function. It's the reason we have pain, is so that we know to do things differently. So we usually start with that story.
And then using analogies with things that kids are familiar with is really important as well. The idea of like a fire alarm kind of going off and whether it needs to be or not. Sometimes smoke alarm goes off when you're cooking dinner, and sometimes it goes off when there's a fire, and it's smoke, but it's a matter of what the message is and what that needs to be, and kind of making that connection that the brain is what's activating the pain, and having them come up with examples that they can think of and having them give them back to us is really key. And it gets them, again, curious about other things in the world that, if you hear, if you hear a fire truck in a parade, you don't tend to have too much of a, you're not worrying about it. But if you hear a fire truck coming down your street, there might be a different reaction. It's the same sound, it's the same truck, it's the same, the same stimulus. We don't use stimulus with the kids, but it's the same thing, but based on what your brain is telling you and the other information that it has, it's making an idea about how to handle it. And so really making those connections for kids in ways that they can understand it.
Yeah, and also the environment too. So we had a child who every morning had severe vomiting before he would go to school.
Wow.
Um,
Mhm.
so we explained to him that because he had experienced a traumatic incident at school, his brain had learned that school is dangerous, and it had generalized it not just to the one hallway where the incident occurred, but to all the classrooms, to the bus ride, to the route to the school, to even the thought of going to school. So his brain was really working hard to keep him safe, to keep him away from a scary, dangerous environment.
Yeah.
So we're able to understand that.
That overlaps with the question I was going to ask, which is the touching of the stove. I think that intuitively makes sense because it's a physical danger. My hand is going to get hurt if I do that. Do you find that translation of from physical danger to emotional danger is an easy one for kids to grasp? I don't know about the student with the trauma in the hallway, if that was physical or just emotional bullying. I used the word just. I did not mean just emotional bullying, but making that translation of the brain detects emotional danger in the same way as physical danger. Do you find that kids get that, or is that more challenging?
Some kids do, some kids do get it. And then some kids, that's where a lot of the activity and experiential based things can come into play. So we'll ask a child, like, how do you feel when you're upset or you're worried and you're in pain? And they might say, like, my heart beats fast, I feel tense, and my hands get, I feel fidgety. And then we'll go, we'll say, all right, let's go outside and play. And we'll run around and we'll do jumping jacks and Simon Says and this and the other thing. And then we'll stop and I'll say, all right, put your hand on your heart. What is it doing? It's beating really fast. Like you might feel tingling in your muscles because we just used them.
You're sweating.
Like and you're sweating.
Mm.
That's the same symptoms, but you're not experiencing worry or fear or any of those things that you would have experienced just by getting a different sensation in a different situation. So with kids creating, and even adults, creating a situation where they can experience the same like kind of somatic or physical sensations, and then really frame it for them that there is no actual danger and you're getting the same symptoms, so you can have that positive experience and do that in an experiential way.
So we're helping them shift how they're relating to their symptoms by that experience. Yeah,
Mhm.
reducing
How
the
they
fear.
interpret those sensations.
Yeah, yeah. Okay, so those were a lot of kind of benefits of learning about this as a child. What do you see as obstacles when they come young as they are? What do you have to overcome with that?
I think the biggest obstacles are the parents sometimes,
Yes.
the caregivers, and unfortunately, a lot of times the medical community.
Yeah.
So, for example, that child who came in with the vomiting, right away, the parents, they brought him to us and they brought him to the medical doctors and they brought him to a psychiatrist and a neurologist. And the poor kid got put on so many medications and had so many diagnoses within a month of time. And for us, it was so clear the link. So we were glad that he was getting checked out medically, of course. We wanted that information. But so many of the diagnoses he was getting were based on neuroplastic issues. So, like the migraines, which I think probably has a physical component, that one's a little tricky. But just a whole list of diagnoses and a whole bunch of medications. And this boy was 11, I think.
Mm-hmm.
So by the time we finished working with him, he had no more migraines. He no longer vomits on his way to school. He's going to school, taking the bus to school, and he's been weaned off all his medications except for one. They're afraid to take him off one of the anxiety medications, which we think he can go off that as well. But
And the biggest obstacle to that was the lack of communication. I think if more providers would be willing and open and find time, which we understand there's barriers to that everyone's, overstaffed and there's not a lot of time, but if we all could have coordinated and shared our thoughts and worked collaboratively, that would have been, I think, really helpful. And so sometimes resistance from the outside providers, but It's tough with parents because they're trying to do everything they
Yeah.
can to stop their child from being in pain. And they want to make sure they're uncovering every possible they don't want to miss anything. They don't
Mhm.
want their child to be in harm's way. So we kind of come in at that point where maybe they've already exhausted a lot of other avenues and now they're at your door and they're like, okay, I don't know what else to do, but there's still not 100% buy-in. Um,
Mm-hmm. Mm-hmm.
so a lot of that psychoeducation and understanding has to kind of come first for the parents as well.
Yeah, and I imagine for the kid, you need your parents' support. They're who you're learning from consistently. So if the parent is second guessing,
Right.
Yeah.
you're going to second guess also.
Yeah.
Yeah. And that's especially harder with the younger kids. With the teens, that we're able to align with them and become a team with them in a way that they
Okay.
trust us and we support them. And, we explain that it's hard for some people to sort of grasp this and might be a little more challenging for your parents. And, we really work on aligning with
Hmm.
them and supporting them. But it's very difficult when every time a new symptom comes up,
Yeah.
they're running them to the doctor and getting a new medication and a new diagnosis. And it can be challenging.
Yeah. What I love that you brought that up, the moving symptoms, the new symptoms. What kind of symptoms for people listening are commonly mind body that a parent can be aware that may show up in this cycle of mind body symptoms?
We've had a bunch of kids diagnosed with POTS.
Okay. Mm-hmm.
That's been a big one. And we've had actually a lot of success in treating that through a mind-body approach. But it's very hard because the medical community gets very involved with that.
Okay.
So there's that. There's a lot of the same things that the adults get. So irritable bowel syndrome, plantar fasciitis, migraines.
And I think for parents, helping them understand the healing process and what's really involved in that and encouraging them to get more information from the medical doctor that if your child, had a broken ankle during a soccer game, that after the allotted amount of time that that's healed, then there should no longer be any issues with that. If it's completely healed, there should not be any pain as a result of that because it's perfectly healthy and it's, all those things are safe. So having the parents understand that, maybe if they need to from their medical doctor, like get that information, like how, we can provide you the research, but encouraging them to confirm that there's really no ongoing issues that you should be concerned about so that when the child's experiencing that, it's not, oh no, did they re-hurt it? Do we need to run you back and have something more taken a look at?
Yeah, I
Nice.
think as adults, we've been led to believe that once you injure yourself, like if you break a wrist, you twist an ankle, it'll never be the same.
Right.
It'll always be a weak spot. And that's just not how the body works. Our bodies heal.
Yeah.
And so it's important to communicate that to the kids. Yes, you did sprain your ankle and it was swollen, but it healed. It's good as new. The doctor x-rayed it, they've examined it, you can move it, you can do this, that, and the other. It's healed. It's okay. You don't have to be afraid of pain in that area anymore.
Yeah. You mentioned earlier something about the healing process. Did you mean what you just talked about of the healing of something that has been broken or damaged or injured? Is that what you're talking about? Or are you talking about the healing process of mind body symptoms and the approach you use?
So when I was talking about the healing process a minute ago, I was referring to the physical healing
Okay.
process. In terms of just, with the parent piece, really having them understand that, because I don't know that that's always, I think as adults, we are often led to believe that, I, bent my finger back in 8th grade and it's still sore.
I fell asleep in a chair the wrong
Like
way.
yeah, exactly.
Yeah.
That's just a mantra that people just we haven't gotten that word out enough. But I do think there is a huge component of the healing through the mind body part and understanding the neural pathways and how your brain connects and gets that pathway with the emotional piece of it that we need to also work on.
Yeah. How do you, so, I have so many questions. First, let's go with what is the general approach, recognizing that each person and each child is very, very different. And so the way that they heal is going to require different tools and approaches. But do you have a certain, I don't know, bullet points that you're trying to get out, like, I don't know, movement and psychoeducation and emotional work, that type of thing? Do you have a way that you're approaching this?
Yeah, and it's more of an ebb and flow. So we don't have a structured kind of thing. But first and foremost is building the relationship with the child or the teen. You have to have that first. So we work on just getting to know them, what they like, what their interests are, what activities they enjoy. And that way we can incorporate that into the treatment later on down the line. So if we have a creative kid, we've got tons of art supplies and bracelet making stuff. If we have an active kid who likes soccer, we have a soccer ball and we'll go out and kick the ball. So we try to get to know them and just be genuine ourselves and bring humor into it and make it fun. So those are the key things we start with and bring into every session.
Yeah.
And then there's certain pain reprocessing techniques we use. So we gather evidence. So we'll actually take out our cheat sheet and say, we'll sit down next to the kid and say, look, these are the things after we do the psychoed piece of explaining neuroplastic pain and how it works in terms that they can understand. These are the things that they say are evidence of neuroplastic pain. And we'll sort of go down the list. Do you have pain on both sides? No? Okay, so we won't check that off. Do you notice the pain when you're running, but not when you're jumping? And we'll sort of go and we'll help them build an evidence list that they can keep. And we can whip out and just, for when there are those doubts or if the parents are questioning, and we'll have them go over the list with the parents too.
Nice.
Yeah. And then the psychoeducation piece is always there whenever we can get psychoeducation in there. And whenever we see evidence in the session, what's your pain level right now? What are the sensations? What does it feel like? All right, let's go have some fun. We'll go out in the middle of the fun. What are you feeling now? Nothing. Can we finish playing the game? And then at the end, what's your sensation now? Wow, that is amazing. Look what your brain did, And then we'll have them educate the parents. We'll educate the parents. We'll have them educate the parents.
We also like to bring in ways for them to understand the information, the psychoeducation in different formats. So there's a show through Disney. It's called Limitless with Chris Hemsworth. He's Thor, if you're not familiar with him, but does a whole series on reducing stress. And they do a very good job of explaining how your brain gives messages to your body and gives out like cortisol and adrenaline and how that whole process works. And so rather than us trying to find the words and do it in here, giving them a way to watch something that's intriguing and fun and a character that they're familiar with and visually appealing, materials about the brain connection will say, when you go home, why don't you guys as a family watch this? And like, you can talk about it. And so finding things that the kids can connect with, that they can then incorporate at home so that it's not just, again, I'm coming to that office, I'm learning a thing, and then I'm leaving and I'm forgetting about it until next time.
That's awesome. I have not seen that movie, but apparently I need to.
Yeah, it's a lot of series. He does different activities. The first couple are really do a nice job of explaining some things.
Oh, it's a series. It's not a movie.
No, it's a series.
Oh, fun. Yeah. Okay. Yeah, I'll check that out. And then what about bottom-up approaches? I'm definitely just plugging because I want to hear you guys talk about this pizza analogy that you use with breathing. I know when I was healing and having to like slow down and do meditation or breathing stuff, that required a lot of self-control because I was in urgency mode and go, go, go. And so to get myself to realize it was okay to be slow and do those sorts of things was challenging as an adult. So I'd love to hear your take on how you work with kids on that.
Well, we can also add in that we have a little bit of an advantage because Kelly's also a certified yoga instructor. So,
Yes.
so sometimes, even with the breathing, we'll have them do some certain stretches, and we'll ask them to describe the sensation in one area, and then we'll ask them to describe the sensations in the area where they've had pain. And a lot of times they'll use the same words. Well, it's a stretching, it's a tightness, it's a tingling. We say, so isn't that so interesting that it's the same sensation, but in this area, your brain has defined it as positive and, oh, it feels like a good stretch. But in this area, your brain has defined it as pain. And so those sorts of things really help them. And then the breathing.
Yeah, and then just a caveat to working with kids and even adults, you know, you need to build in breaks and fun in between. So just trying to give an entire session on psychoeducation, you'll lose kids. Like you can't, you know, you have to break it up with lots of, but finding, again, with the breathing, finding ways to connect, you know, it's become kind of a buzzword to be mindful, to take a deep breath, you know, explaining why that's important, like why you need to train your brain how to take deep breaths. You don't want to just do that when you're upset. And we tell that to the parents too. Don't wait till your child's in excruciating pain or really anxious and worked up to say, okay, practice your breathing. Like your brain's already on high alert. So it's really training your, you know, training yourself to be prepared for when something comes up. And so the pizza and the hot chocolate breath was really designed so that you can work on slowly inhaling and slowly exhaling, because when you tell any kid to take a deep breath, they're like, you know, they almost hyperventilating because there's an urgency. Like if the faster I breathe, maybe the faster this won't hurt anymore. So really getting them to visualize and slow down and take the deep breaths. I mean, we're not against actually practicing it with real hot chocolate, so they get a real visceral response to, you know, when I breathe in, I don't want to inhale a nose full of whipped cream. So I need to take a nice slow inhale and then slowly breathe out. And so having them really experience it as much as possible makes the best connections.
Yeah. And the pizza one is about breathing in slow, so you're not inhaling the cheese. Is that what I remember?
Yes, yes. You want to really take a nice yummy smell in, but you don't want to blow that cheese right off, because that's the best part of pizza.
I love it.
And once you do a couple of them, then you can say to a kid, like, well, what are other things you could think of? You know, like, you know, blowing out candles on a birthday cake. You don't want to inhale the flame. You don't want to spit all over everybody at the party. So like you come up and then they get sillier and sillier, and, you know, everybody can have a good laugh and you're bringing in humor, and it makes it a real positive experience as opposed to what they're used to, which is going to a doctor and maybe hearing big words they don't understand and feeling powerless in how to help be a part of the healing process. So, you know, really making those positive connections goes a long way.
And then we have the parents come in, and the child teaches the parents how to do the breath work. That way the parents can do it with them. They can encourage them to do it. And, you know.
So is there a part of the session where it's just the three of you, and then a part that the parents are involved with too?
We usually start out with us, the child, and the parent or parents. Just, you know, how was the week? Anything new we need to know about? Did you do any practicing? That sort of thing. Then we'll give the parents the boot, which the kid loves. And then we'll have some fun and we'll work with the child. And then usually at the end of the session, we'll bring the parent back in for a few minutes so the child can teach them any new techniques, or we can talk about goals or things like that.
Gotcha.
We also encourage the parents to communicate anything, maybe anything they're questioning from the medical standpoint through like an email, or try to make a phone call ahead of time. So they're not talking, again, in scary medical terms in front of their child. So we want that information. We, of course, want to be kept in the loop, but we, again, don't want to feel like if for a child session that the adults are all talking around them again. We want them to really feel a part of their own, you know, process without, again, feeling inferior because all the adults are talking about big scary words and I'm hearing things I don't know what they mean. And so we encourage the parents to do that in a different way so that we have the information and we're not spending the time, you know, talking about that in front of the kids.
I love that, you guys. It just makes the kid feel empowered, right?
Yes.
Yeah. Okay. I want to ask a awkward question. So, um, I work with adults, and I know you work with adults also. And we're always healing a wound. You know, there's something that we're healing. There's a reason our brain is on high alert. And sometimes that is the parent that you're going back and you're healing from high alert that you had because of a parent's response to you, XYZ. Now, knowing full well that there are many other reasons, and I want that caveat just because I don't want a parent watching to be like, oh my gosh, it has to be my fault. I mean, there are so many reasons. It is not always the parent. But for parents listening that want to look out and see, like, I want to be humble and say, is there some way that I'm relating to my child's emotions that might be part of the high alert? How can we, I just want to be so gracious. How can we love on the parents listening and give some things for them to think about or question about their way they're relating to their child?
So the best thing the parents can do for their children is to take care of their own emotional health and well-being. So for a lot of parents, that might mean going to a weekly yoga class. For other parents, it might mean, you know what, let me get into my own therapy and explore. Are there any ways where I might unknowingly be contributing to this issue? Like, let me explore my own stuff. There's nothing better that you can do for your child than taking care of your own emotional health. So oftentimes parents might be contributing, but for the best of reasons. So that the parents with the child who had trouble walking on the hikes, they would go into a panic because their kid would be crying in extreme pain, and it's scary seeing your child like that. So their response was sort of a panic response, which then escalates the child's fear response, which then escalates the pain response.
Yeah.
So, the parent with the best of intentions might be reacting with a high anxiety response, which then escalates the situation as opposed to resolving the situation. So there are times when, if we see some evidence of that, we'll work with the parent on their own in ways that they can better help their child. And, to provide the psychoed that when you react to an anxiety response with a higher level of anxiety, it escalates.
Yeah.
So as best they can, we know it's scary and it's horrible to see your child in pain. But if they can understand the psychoed piece of the neuroplastic pain, then they can learn to have a more effective response and better help their child.
Love it.
Sharing with the parents some of the things that we know personality wise that can contribute to neuroplastic pain can be helpful as well, because when you go through that and you start to look for evidence, oh well, am I a perfectionist? Is there a lot of intensity? Is there a lot of stress in my job? What are my kids getting to see in my behavior that might be contributing to things? Do I overreact to small things? Am I, just giving them an opportunity to kind of explore that and encourage them to explore that, not in a this is your fault or blame kind of way, but more in a we're all human and we're all learning and we're all, exploring that. So helping guide them to kind of see what's happening on their end is really helpful.
And we also explore with the parents and the kids also, but we explore with the parents very delicately the topic of secondary gains.
Okay.
So one child whose physical ailments kept the mom and the daughter very close because they spent all their time together going to various doctor's appointments. And the mom really got to feel good about being her daughter's hero. So she had the best of intentions, but there was a little bit of secondary gain there that was getting in the way. So we could teach her healthier ways to build the relationship with her daughter. And for the child, there's often the secondary gain of attention.
Yeah.
So we can work with the parent on how to better give positive attention.
Yeah. Do you ever bring that up with the child, or is it just the parent that you want to understand that concept?
We bring it up with the child too, depending,
Okay.
but very gently, wow, that must be really nice that your mom takes such good care of you, your dad takes such good care of you. That must be really nice to have that extra time with your mom or dad. What kind of fun things do you like to do with your parents? And we'll sort of
Maneuver them, creating a connection with their parent in a way that's a little bit more healthy.
yeah.
I love that. I think we are, I was more accustomed to hearing about adults with chronic pain and symptoms. And as we learn more and more about this, we're finding that kids are also just as susceptible to mind-body symptoms as we are as adults. I can't remember what you said, but in the psychophysiologic disorder conference, you were talking about percentages of kids. Do you remember what those numbers were? I think the reason I'm bringing that up is because I imagine I'm not a parent. That's why I'm not talking about this. I'm asking you guys all the questions. I imagine as a parent, your child has a symptom, even if you know about mind-body syndrome. There's got to be like a protective love that comes up in the form of fear sometimes. And so I think just knowledge is so helpful. I would imagine as a parent to know it's really common for kids to have mind-body syndrome. So what do you have to say about that? Do you remember the numbers?
Yeah, so I actually wrote them down. So the median prevalence of chronic pain reported in community samples of children and adolescents is 11 to 38%. But we would guess that it's probably even higher than that. And I think a lot of people in the field, probably a lot of people that presented at the conference, they can remember symptoms as early back as childhood. Yeah.
Absolutely.
Either they don't get talked about or they don't get addressed, or it was dealt with medically, or.
Yeah.
And finding with parents, like what you mentioned, that there is this, there's a parental need to protect and worry, but there's also there's been an increase in societal attention on child safety. Totally, I played on a playground on blacktop and the monkey bars weren't on, turf. But in reality, now that there's more research on concussions and heart issues, whenever my children sign up for a sporting event, it's like 3 pages of waivers that have horribly scary things in there. Like you're waving away that they could have some, hidden
drop dead.
Yeah, there's some hidden heart problem that we don't know about, or if they, it's very scary information that's going out to parents, and it's important. And I'm not suggesting that that shouldn't be the case, but I think also equally educating parents on how to reduce their own anxieties, and also to look at things logically and gather, making more awareness of mind body in general. I think it's luckily coming more to the forefront in, common language and society, but really making that delineation between, the reality of this, and that it's not just in your head, and that there's a lot that can be done there.
Yeah, and I also just want to throw out there that we absolutely believe in taking your kid to the medical doctor. So I'm a mom, and even with all this education on neuroplastic pain, I'm the first one to run my kid to the doctor with a symptom. So I do that just for my own fear as a mama, mama bear. And then based on the doctor's feedback, then we go home and I can sort of take that information and say, all right, so more likely this is a plastic issue, or more likely he injured it when playing on the playground.
Yeah. Okay. Did you mention your child is in high school? Is that right?
Both of us have
Yeah.
children.
You have children in high school. So I work at a high school part-time, and then I do this part-time. And I am constantly hearing high school kids, huge stomach ache. Oh, I have a terrible headache. And it's often when there's an exam or there's a test. And Yeah. So just knowing, like we just talked about the parent and them modeling, but there's also just the pressure of being a teenager. I mean, I being in the district again, and seeing the pressure that the kids go through. If I was in that, I think I'd have a headache every once in a while. My stomach would hurt. I don't know, just seeing the kids in and what we don't recognize as maybe more pressure than.
Yeah, and I think having that awareness and encouraging kids to start early at taking better care of themselves and helping model that for them. Just talking to a friend of mine who's got a very high achieving son in high school and, on multiple run, is involved in multiple activities and was exhausted and really just had too many days of being at school late for different things. And she said, why don't you just take tomorrow off? And it was like a foreign concept to this young man. He was like, what are you saying?
Yeah.
And she was like, take the day. Like, you need a day to rest, recharge, and then you'll be much better off the next
Wow.
few days after that to be able to think more clearly. And she was fascinated because here she was a believer in that, and yet he still was feeling that intense pressure from the outside world that sometimes the parent needs to step in and walk the fine line of like teaching self-care and not avoidance behavior, because you don't want to say, oh, you have a headache, stay home, but start to notice patterns of stress and model it preemptively as opposed to reactively.
Oh, I love that. I love seeing the contrast between avoidance and self-care, and how it may look like the same thing, but your intention is very, very different. That's good.
And you zoom in on the emotion and make that connection between the affect and the physical symptom.
Yeah. Yeah. Okay. So in starting to wrap up here, what suggestions or what words of advice, what do you want to share with, we're going to go two categories. One, if there is a teenager listening, what advice would you give them? And then we'll shift to what advice would you give to parents. So let's start with teenagers.
So teenagers, I would say, really keep doing the hard work, not just in school, but on yourself. Really start to take time to see how you're feeling. Less screen time and more outdoor time just to be with your thoughts and continue to remain in touch with who you are and as you're figuring that out. But if you need help, ask for it. You don't need to suffer in silence. And there are people out there that can help you in a fun way. It's not, a punitive way. So
And put words to what you're feeling. Give space to your feelings. So whatever it is you're feeling, you don't have to justify it. You can just feel it and put words into it. Because if you say, well, that's stupid, I shouldn't be feeling anxious about that, or that's, if an adult tells you, what are you sad for? You have nothing to be sad about. You're entitled to be sad. And if you don't put words to it and make space for it, it's going to go right into your body.
Yeah. So good. Just feel your feelings.
yes.
Okay. And then advice for parents.
Now, this goes back to their self-care. Get your butts in therapy. Even if, you're happy-go-lucky, it can never hurt. It's really, it's a journey, getting to a place of emotional health. I don't know anybody that says, I've made it, I'm here. It's a constant journey. So take care of yourself. If you're not ready to tackle therapy, do some yoga, bring fun back into your life, connect with the things that bring you joy. What did you used to enjoy before you had kids? Remember back in the day, you used to do stuff for yourself and have fun and laugh, and reconnect with those things and bring them back into your life.
And don't be afraid to share some of your own experiences with your kids. So if I'm having, if I'm experiencing some sort of pain response, if my back starts to hurt or my neck starts to hurt, I'll verbalize it. I'll be like, it's really interesting that today was a particularly stressful situation with XYZ, and I didn't do anything physically, but I'm experiencing some tension and pain in my neck. And I know that that's going on for me. And my kids are a little bit older, so I'll explain that to them, and I'll talk about how I know that maybe now I need to take a break. Kind of trained my kids to say, like, all right, why don't you sit down for a minute? Like, you've been running around too much. Like, now they're telling me to sit down and take a minute. So it's
That's awesome.
yeah, it's great. But bringing that culture and that mindset into the family, so that you're all working together, and it's a way that you all want to be, and it's not just parent telling child, like, you need to go to bed, you need more rest. It's probably you all need to go to bed and you all need more rest.
Yeah. Love it. Oh, thanks. Thank you to both of you. Okay. In final closing, we just have to talk about your shirts, your matching merchandise, and your website, how people can get a hold of you, that kind of stuff. So tell us what you have.
So you can reach us at dualtherapistmodel.com.
Okay.
And what was the other part of that?
Oh, the shirts are just, we found a way to reduce stress in our day, and we decided to get merch and wear comfortable clothes, because honestly, we're outside a lot with our clients, and we're, moving around. So we're pretty comfortable. And so we decided to,
it's our logo,
not worry about
wellness outside the box. Love it.
Worry about what we were wearing every day. So
that's so good, that I call it doing the work up front to reduce stress. So you don't have to worry about what you're wearing every day.
for anybody who wants to understand this model, because it is different, a lot of times when people hear it, they're like, wait, what? They work together? We did just do a TEDx talk on YouTube. It's now on YouTube, and it really goes through what our dual therapist model is involved. So that's up on YouTube.
And there's a lot more information on our website as well.
Okay. I will make sure and put that all in the show notes. So to clarify, you do not sell your merchandise? The sweatshirts are just for yours? Oh, okay. Here I thought I was trying to sell your merch for you, but
hey,
later, another time. All right. Well, thank you so much. I appreciate both of your expertise. I know that there are going to be many parents who will be encouraged by this, and therefore that will trickle down to their kids. So thank you so much.
Oh, thank you. We appreciate you putting this message out there for everybody. So thank you.
Yeah. All right. And thank you to the watchers. I will see you guys next week.